There is something wrong with you. There is something so wrong that you need medication to fix your problem. And the more you act up or grow tolerant to that medication, the more we give you. Those words of disapproval can especially hurt if the person on the receiving end looks up to you. Parents may not say it out loud, but what are we really saying when we give our children medications to treat attention deficit hyperactivity disorder? It may help for a while, but what does it actually fix? If you give your child medication to behave normally, they will not be able to live a normal life without it. A healthy childhood paves the way to a bright and healthy future. We owe it to our youth to know if the medications used during treatment are worth using, and if non-medicated forms of treatment are just as effective, because it can mean all the difference in your child's future. There are side effects to any prescribed drug. However, it is important that we examine the side effects to determine if the prescribed drugs are conducive to the child's overall health. According to the New York Times Health Guide, most of the commonly used prescription drugs for treatment are stimulants and have caused unexpected death in children and adults with heart conditions. ADHD stimulants can worsen behaviors and thought disturbances in persons already suffering from psychiatric disorders, and also increase the risk for those who do not have psychiatric problems. The most common side effects are decreased appetite, sleeplessness, depression, hair loss, and lack of spontaneity. Carefree expression and spontaneity are two very distinctive characteristics of a happy childhood. Those drugs drain them of childhood experiences they may not get to know later on in life. Sleep rejuvenates the body, and if not sleeping properly, they may not be able to do as well as they can in school, which is the main concern of ADHD in the first place. ClinicalAdvisor.com, a website for nurse practitioners and physician assistants, states that between 1998 and 2005, there was a 76% increase in the calls to the Association of the Centers of Poison Control related to the abuse of prescription ADHD drugs in teenage victims. Addiction itself is caused by several factors, some of which being environmental and genetic. Another factor can also be mental health issues. People with anxiety or depression are especially prone to substance abuse to make them feel better or cope with their issues. But since the drugs give a good feeling but do not actually fix the problem, they enter into a vicious cycle. As stated earlier, the most popular prescription drugs used for ADHD treatments are stimulants. Stimulants block the dopamine receptors and allow chemicals to build up in the brain. Dopamine is the chemical in the brain associated with pleasure or reward. And the chemical is released during actions such as eating, drinking, or sexual activity. When this chemical is released, it makes you feel good. And since the receptors are blocked, it allows the chemical to flood the brain, causing a rush and instant gratification, interrupting the chemical balance of the brain. In an attempt to adapt to the imbalance, the brain will then produce less normal amounts of dopamine, which would explain tolerance to the drug and also having a dull feeling when not using it. Do not let the easy way out dim the bright possibilities in your child's future. These staggering side effects of ADHD treatment medications warrant a hard look into non-medicated forms of treatment.